Hey everybody, welcome back to the Teach Back Method, where I teach you guys something I'm learning about in grad school to help me understand it better. For today's video, I'm going to be discussing clinical practice guidelines. Let's break it down. So, what are clinical practice guidelines? Here are a few definitions. So, they are systemically developed statements aimed at helping people make clinical, policy-related, and system-related decisions. They are recommendations to optimize patient care, and they assist practitioners and patient decisions. CPGs do have a variety of uses, so here's a couple of them. So, they are recommendations for a given health condition. They help to improve the effectiveness, safety, outcomes, and efficiency of healthcare. They also discourage us from using outdated data and encourage us to use the most recent data. And then lastly, it can help reduce variation in clinical practice. So how one physical therapist treats a patient over here in this clinic, another therapist can also be using the same practices, assuming they're both abiding by the clinical practice guidelines. CPGs are beneficial to everyone involved. They are beneficial to patients because patients are more willing to comply with a treatment that has been validated and is widely used and accepted. Beneficial to clinicians because it helps to reduce variation in practice and it encourages clinicians to stay up to date on recent research. It is beneficial to the profession because it sets expectations of care. And then lastly, it is beneficial to the payers because CPGs actually help us to cut down unnecessary costs. CPGs do have their limitations as they are very time consuming to develop. They can get outdated very quickly depending on the medical topic. There is typically a lack of high quality evidence, and of course there is risk and potential for subjectivity bias between the different practitioners that are trying to use the CPG. As I stated previously, CPGs are very time consuming to develop. So here are all the steps that are involved in developing a CPG. The first step is a systematic search, screening, review, and selection of current data. Then we are assigning the level of evidence. Next up is critical appraisal, utilizing a critical appraisal tool. Next up, we're adjusting the evidence as appropriate. Next, we're going to weigh the benefits and harms. And then lastly is the actual writing of the recommendation. The final thing I'd like to go over is the current hierarchy of evidence of available research. So at the very top, the best evidence that we can find are, of course, CPGs, our clinical practice guidelines. Next up is any systematic review or meta-analysis. Following that are the randomized controlled trials. After that are cohort studies. Then we have non-experimental design, case theories, or case reports. And then lastly, the weakest level of evidence is, of course, any expert opinion. I hope you guys learned something in today's video. Come back to my page to learn more.